Okay, so here we are again. Thanks, everybody. Well done. Very efficient breaks. I appreciate you all getting back in time. So I just wanted to introduce you to our closing keynote speaker, Terri Ottosen. Terri has been a health sciences librarian for over 25 years and is a distinguished member of the Academy of Health Information Professionals. Currently, she's the Community Engagement and Health Literacy Librarian at the Health Sciences Library, UNC Chapel Hill. She provides community outreach services and instruction on topics such as clear health communication, plain language, consumer health resources, and patient education. Terri has an extensive background and expertise in consumer health, patient advocacy, and health literacy. She's taught numerous classes, both in person and online, on a variety of topics pertaining to consumer health and making informed healthcare decisions. She is a passionate and experienced advocate for patient empowerment and engagement. Terri is dedicated to increasing awareness of health literacy and improving the health literacy skills of health consumers, students, and health professionals. We are thrilled she's here with us today. Please join me in welcoming Terri Ottosen.
Terri, take it away. Thank you very much. Thank you for that nice introduction. It's really an honor to be asked to serve as this year's closing keynote speaker. I hope you are finding the conference informative and inspirational and learning new things to take back and incorporate into your work lives. And in my talk today, I hope to provide you with a little bit of that as well and talk to you about health information, health literacy, and the ways that librarians can profoundly impact the health of individual people, but also the health of their communities. Specifically, I will talk about what health literacy is, its impact on both the individual and the community at large, and then I'm going to talk about how you can provide consumer health information services at your library, including some free online resources, some things to consider when you provide that type of service, and then what might be some challenges for doing that. And of course, we don't want to go into all of this alone. So I'll talk about some ideas for collaboration and health outreach, including where you can get training and support for that outreach, as well as some creative examples of librarians providing health outreach programming and services. Now let's start with just an overview of health literacy, what it is, and what the impact of low health literacy is. So at first, health literacy was considered to be a skill on the part of the individual, and it's a characteristic. A low health literacy was considered to be a deficit on the part of the individual. But health literacy really emerges from an interaction between the demands of the healthcare system and people's skills. And unfortunately, the term has been used frequently just to focus on the skills of the individual alone, without attention to the demands and assumptions, the words in the text, as well as the social factors and context that shape skills and abilities. Although the literacy and verbal skills of individuals are critically important, so too are the demands made by the health materials themselves, the communication skills of those in the healthcare field, and the complicated nature of healthcare and public health systems. So health literacy is really a shared function of social and individual factors. And an individual's health literacy skills and capacities are mediated by their education, culture, and language. Equally important are the communication and assessment skills of the people with whom individuals interact regarding their health, as well as the ability of the media, the marketplace, and government agencies to provide health information in a manner that's appropriate for the audience. And we know many people get health information from a wide variety of media, including social media, So we need to help people find and use health information that is reliable and authoritative, and the ability to use that information to make informed decisions, as well as helping them prepare for their healthcare interactions. Tracy Hall really went and made a point about this in her opening keynote, that we have to move beyond access, which is still critical, but we have to move beyond and help people develop skills, and then to be able to take action using those skills. So as the definitions have evolved, there has been a recent change in Healthy People 2030's definition of health literacy. This is a set of 10-year national health objectives, and the 2030 definitions for the first time included the idea of organizational health literacy as well. So the original definition in Healthy People 2010 was the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Now, the new definitions emphasize people's ability to use health information rather than just understand it. And it focuses on the ability to make well-informed decisions rather than appropriate ones. It also incorporates a public health perspective and acknowledges that organizations have a responsibility to address health literacy. From a public health perspective, these definitions indicate that people and organizations can use their health literacy skills to improve the health of their communities and its members. Health literacy occurs when a society provides accurate health information and services that people can easily find, understand, and use to inform their decisions and action. So businesses, educators, community leaders, government agencies, health insurers, healthcare providers, the media, and many other organizations and individuals all have a part to play in improving health literacy in our society, including libraries. Low health literacy is not a fixed trait of a person or group. I like the phrase that it's a state, not a trait. So it's a consequence of contextual factors and how that information is presented. Research shows us that low health literacy is less of a problem when we deliver information and services in ways that make it easier for people to understand and take action. So more than 75% of adults in the US have searched for health information online. Almost 9 out of 10 adults may lack the skills needed to manage their health and prevent disease. And approximately only 12% of adults have the skills needed to effectively manage their health and prevent disease, according to an evidence-based review of health literacy interventions. 50% of the US adult population, or about 90 million adults, fall into the low or basic health literacy category, according to the National Assessment of Adult Literacy. Now, some of these statistics are a bit older, but in 2006, only 1/4 of online health seekers said that they always or usually check the source and date of the health information online. And I would estimate that's probably still true today, if not higher. With online health misinformation and social media influence, there's been a shift from how we can get evidence-based information to our target audience to how we can get our audience to share evidence-based information. Now, in 2012, approximately 77% of online health information searchers began their search at a search engine like Google, Bing, or Yahoo. And I'll talk a little bit about how we can help guide people when it comes to that. And it was estimated in 2018 that 1 in every 20 Google searches is related to health. Most frequently, people went online to look up information about a specific disease or medical problem, with 63%, a particular medical treatment or procedure, 47%, diet, nutrition, or vitamins at 44%, exercise or fitness information at 36%. Other popular health topics include prescription or over-the-counter drugs at 34% of people looking, alternative treatments, 28%, health insurance, 25%, depression, anxiety, or stress at 21%, or they looked up a particular doctor or hospital at 21%. Overall, research indicates that looking for health or medical information is one of the most popular activities online, and there are studies relating to COVID-19's impact on information searching behavior. And from what I've read so far, there has been an increased demand for information. However, certain search terms and concerns varied by where people were searching across the country. Now, according to the American Medical Association, poor health literacy is a stronger predictor of a person's health than their age, their income, employment status, education level, and race. Patients with low health literacy have less knowledge about how to manage their health or illness compared with patients who have adequate health literacy. And a large body of research shows that health literacy affects nearly every aspect of health, from a person's medical knowledge to their mortality. On average, adults with low health literacy have less knowledge about their medical conditions. They may not know what their blood pressure or blood glucose should be. They may not recognize signs and symptoms of common medical conditions. They may make less use of preventive health services, so things like mammographies, pap smears, or vaccines. They may have difficulty in managing an illness or a chronic condition. For example, they may not use an asthma inhaler correctly, or they may have difficulty reading and understanding prescription drug labels. They may not effectively manage early signs of heart failure or a stroke. They also may have poor disease control and tend to have higher blood pressure and glucose values. And they may utilize healthcare excessively, like more likely to seek care in an emergency department and be admitted to the hospital. And of course, overall, they may have a higher mortality rate. And low health literacy is a key contributor to healthcare disparities. So as consumers assume greater responsibility for their own healthcare, they're being asked to make more and more complex decisions than ever before. This is fueled largely by the move to managed care, the consumer health movement, and the internet. At the same time, the increase in available information and then how it's customized for a particular person all ratchets up this need for understandable information. We've also seen the speeding up of information and recommendations that change quickly, as well as the overwhelming amount of misinformation and disinformation, confusing and contradictory information, which makes it even more difficult for people to understand and then to use that information to make decisions specific to themselves and their values. Now, many public librarians are not familiar with health information resources, whereas health sciences librarians usually work with health professionals who know what their information they're seeking, they know how to spell it, and they're able to convey that specific information need. For public librarians or those not in the health sciences, they may not get health-related questions often, or if they do, it might take much longer to help someone. So let's look at some of the challenges to providing consumer health information services at your library and some possible resources to assist. Now, public libraries are free and accessible to everyone, and they're a center of community engagement and education, and that makes them a logical choice as partners for improving population health. Library staff members routinely assist patrons with unmet health and social needs. Literacy, which is a core mission of libraries, is a cornerstone of lifelong health. And recent research conducted in Philadelphia showed that public libraries often engage in health-related roles that extend beyond circulation of reading materials. More than a third of inquiries to public librarians include questions about health. Public libraries also serve as places of refuge for vulnerable populations, including people experiencing mental illness, homelessness, immigration challenges, and trauma, and they regularly assist patrons who have unmet health and social needs, but often feel ill-equipped to address these patron needs. It's much harder for public library staff, and in this survey, many public library staff felt significantly less prepared to address health and social questions from patrons, such as questions about housing, food, and post-incarceration assistance. Many of the libraries surveyed offered health-related programming, including health insurance enrollment clinics, immunization and health screening clinics, cooking classes, and 86% reported offering social activities like book groups or knitting clubs at their library. And additional health-related programming reported by 60 respondents included weight loss support, healthy snack and free lunch programs, and social services enrollment assistance like with food stamps or Social Security, as well as information sessions, speaker series, and health fairs. The responses to this survey demonstrated a mismatch between patron demand and library supply of health-related programming. For example, although 70% of respondents reported frequent patron questions about nutrition, only about 37% of the libraries reported offering nutrition classes. Similarly, just over 11% of respondents said that their branch offered mental health support groups, whereas about 50% said that they had regular interactions with patrons about mental illness. Besides not offering programming, respondents often felt unprepared to offer these services, highlighting a source of job strain. And more than half of respondents reported sometimes or often not knowing how to answer their patrons' health questions or how to solve the social problems their patrons asked them about. And about half of the respondents reported experiencing stress from working with patrons. And in the past year, 42% of the respondents were harassed by a patron, and 24% felt physically unsafe while at work. So one of the things that you can do to help your community is to understand their health needs in your particular area. And these are some tools to understand the demographics and health needs of your community. And I'm not going to go to these right now, but they'll be available in the slides and in the handout for you to explore. Policymakers and public health practitioners rarely consider libraries to be community level resources that can advance population health or address health disparities, despite several characteristics that could render them highly effective at doing so. With an estimated 17,000 public libraries nationwide and 4 million visits each day, libraries have extensive population reach. And furthermore, unlike other service providing institutions, libraries are widely trusted by the public. And these factors make them an opportune space for the coordination and delivery of health promoting services. Studies show that patrons often use libraries to access health information, particularly in rural areas and in communities that lack home internet access. And with the proliferation of health information available on the internet, public library staff play an increasingly important role as information navigators, and some libraries are even employing health-specific librarians and trained staff to provide authoritative health-related resources. One of the best ways to inform what's needed at your library is to keep track of health-related information requests over time. And this will give you a great snapshot of what you have been asked about and what you might want to prepare to help meet those needs. There is also something called DRGs, and this is diagnostic related groups of a hospital or a health system near you. And this is basically a list of the top health diagnoses at that facility, but it's often hard to gather that information, short of calling that facility and asking. Now, just as with any good reference interview, it's a process that determines the information needs of the customer. And the aim of the interview is to translate the patron's questions into ones that can be answered with the library's resources. And particularly in the context of health information, when you may not have a good physical book health collection, you need to use your existing resources, but also know when you have reached the limit of your own resources and knowledge, and when to refer that patron back to his or her doctor. Now, it's often hard to provide a private space for health-related questions in a small library. And I personally am from a very small town in Virginia, so I know what it's like when everybody knows your business. But whenever it's possible, try to provide that privacy. Perhaps even invite the person to sit down with you at your computer, or conduct the reference interview in a more private area of the library. It's also important to follow some guidelines for knowing the limits in your role as a librarian, such as not providing advice, like who's the best surgeon in town, or for interpreting medical information. And that includes even things like, what does this word mean? And even if you know what that word means, by providing a definition, you are interpreting what it means. So the best thing to do is to sit someone down with a medical dictionary or an online medical dictionary. It's also important to post disclaimers, either at the point of the interaction, so you might state this verbally to someone asking, or any written materials that you may provide to someone should have a disclaimer statement on it. Now, if you were creating a new consumer health service at your library, think about what kind of things would be important to you. What can you afford to provide? I would venture to say not many libraries can afford a physical collection of health books. Where can you get support? Who might you partner with to provide services or programming? So some of the resources I'm going to show you in a few minutes are all free and online. I managed a hospital library with zero budget for consumer health type materials. And I was able to provide information just with a small reference collection, which I'll mention in a few minutes as well, and all of the resources found on the internet. And this has been a great change from when I was a baby librarian, when PubMed and the health professionals literature databases cost money, and I would have to formulate my search offline and use as little time as possible so the library was not charged a great amount of money for that search. Now, there's lots of great help for you now. The consumer health information specialization, I'd like to point out in particular. This is from the network of the National Library of Medicine and the Medical Library Association. So it's a way for you to earn this certificate online through free classes. And I've got some links here for you. They also have, NNLM has funding available for outreach projects. And I, full disclosure, before coming to UNC, I worked for NNLM for over 12 years. So I'm going to give my contact information and feel free to contact me if you have any questions about this. Also, at the Health Sciences Library here at UNC Chapel Hill, we have an Ask Us service that you can use, but you can also refer your patrons to us if they have a consumer health question that you're not able to answer. Now, briefly, collection development, again, it's very costly to buy medical books, and consumer health books should be no more than 5 years old. Of course, the exceptions are things like anatomy and physiology, because that doesn't change. And some libraries purchase the physician's desk reference every year, which is fairly expensive. And instead, I would recommend that you buy a lower cost nursing drug handbook that you can afford to replace every year, because drug books should not be older than 1 year. And the PDR really is just a compilation of the package inserts for prescription drugs. So there are better resources for that information. And the Medical Library Association has a Consumer and Patient Health Information Services Caucus that lists top health websites every year and also can provide some guidance for collections. So let's take a look at some of these free consumer health information sites online, and we'll talk a bit about evaluating the quality of some of the information found on the internet. So the most recommended starting place by health sciences librarian is MedlinePlus.gov. And why is this? MedlinePlus was developed and is maintained by the National Library of Medicine, which is one of the National Institutes of Health. And they have a physical library, which is the world's largest biomedical library, and it sits on the NIH campus in Bethesda, Maryland. It has over 1,000 health topics, with most content of the site also available in Spanish. And that can be accessed even if you don't speak Spanish, just by clicking on the Espanol button at the top of each page. Information is regularly reviewed and updated by an entire team at the National Library of Medicine, and there are no advertisements allowed as it's a government site. There's also extensive drug and supplement information, a wide variety of videos and health tech check tools, and a medical encyclopedia. And one of the most helpful sections for people with low health literacy or anyone seeking easy to understand materials is the easy to read section. And most health topics also have information about getting financial assistance having to do with that health issue or medication. Now here's the homepage of MedlinePlus.gov. And notice on near the bottom right, you can sign up for the general newsletter. You can also reach all the available health topics, which when you click on will take you to the various ways to access the information, such as alphabetical list or by body location, demographics, or treatments. There's also a form on the home page, again near the bottom right, which will allow you to subscribe to the MedlinePlus magazine. And there's a link under the MedlinePlus about MedlinePlus near the top right, and that will lead you to information on how to link to MedlinePlus on your library's website, information for trainers and librarians. There's a social media toolkit, and a lot more there to help you use the site effectively. Now, NC Health Info is dedicated to empowering your healthcare decisions, and it is a dual language online consumer health guide. It consists of reliable and easy to understand resources to help you make informed decisions about your healthcare. And topics range from researching common illnesses, medications, and therapies to help you finding a provider or a service, as well as what questions to ask your doctor and where to find free and discounted medical services in your area. All links on this site have been carefully reviewed and selected by librarians at the University of North Carolina at Chapel Hill, as well as volunteer librarians located across the state of North Carolina. We review the resources twice per year to ensure accuracy and relevance. And again, we also have an Ask Us form, which can be used by anyone seeking health information. Now, clinicaltrials.gov is a free website, and it provides patients and their family members, as well as healthcare professionals, researchers, and the public with easy access to information on publicly and privately supported clinical studies on a wide range of diseases and conditions. Clinical trials are part of clinical research, and they're at the heart of all medical advances. Clinical trials look at new ways to prevent, detect, or treat disease. And treatments might be new drugs or new combination of drugs, new surgical procedures or devices, or new ways to use existing treatments. And the goal of clinical trials is to determine if a new test or treatment works and is safe. Clinical trials can also look at other aspects of care, such as improving the quality of life for people with chronic illnesses. People participate in clinical trials for a variety of reasons, and healthy volunteers say they participate to help others and to contribute to moving science forward. They also offer hope for many people and an opportunity to help researchers find better treatment for others in the future. And this website is also maintained by the National Library of Medicine at the National Institutes of Health. Now, the National Center for Complementary and Integrative Health is the federal government's lead agency for scientific research on complementary and integrative health approaches, and it also is one of the National Institutes of Health. Its mission is to determine through scientific investigation the fundamental science, usefulness, and safety of complementary and integrative health approaches and their roles in improving health and healthcare. So this really makes it an excellent starting point for things like supplements, or to find a trustworthy provider of these types of treatment, like acupuncture, zinc, melatonin, that kind of information need. And it's a better starting place than Google for this type of information, as chances are, if you put this in those kind of terms in Google, you're going to get back pages and pages of advertisements rather than evidence-based information. So as we know, most people start at a search engine, which is fine. I mean, I'm a everyday Google user, but we also need to help people be able to evaluate the information they find when they're not using a recommended website. There's a great tutorial on MedlinePlus about finding and evaluating online resources, as well as there are dozens, if not hundreds, of great tutorials and classes that will help you provide this type of information to your patrons as you help them search. Now, I'm showing WebMD here to illustrate that while many people are familiar with this site, and they do advertise, it is sponsored by pharmaceutical companies, and it's a .com. So while there are some good information on this site, it's also a good idea to confirm with another trustworthy source before using that information to make an informed decision. So let's talk about potential collaborators in your outreach. There are a lot of them. NNLM, as I mentioned, the network of the National Library of Medicine, the Medical Library Association, the caucus within MLA, other health sciences libraries and librarians, but also the American Library Association and the Public Library Association have groups that I will show on the next slide. But in addition, there's also local community clinics, hospitals, healthcare professionals in your area, local chapters of support groups or other health organizations, and of course, faith organizations. There are also local chapters of health sciences librarians, MAC, which is the Mid-Atlantic chapter of MLA, and ANCHASL, which is the Association of North Carolina Health and Science Libraries. So as I mentioned, the Ask Us service is available to you, nchealthinfo.org and nchealthliteracy.org, which I will show in the last slide. Just for reference, there will be a tab for librarians there that has more information about resources and training. And of course, I mentioned NNLM, and we're very lucky in North Carolina to have NC Live, which has an extensive health and medical collection, including CINAHL, which is the Cumulative Index to Nursing and Allied Health Literature, which is something that many libraries have to pay a lot of money for. And Web Junction has a section called Health Happens in Libraries that has trainings and materials. And as I mentioned, the Public Library Association has a health interest group. So now I'd just like to show some creative health programming examples. You may have heard of Story Walks, which combines reading with moving and getting some exercise in the outdoors. Dr. Noah Lenstra, a professor at UNC Greensboro, has a great Twitter feed that I follow, so you can learn much more about these various efforts. And Let's Move in Libraries is a nonprofit group that helps libraries promote health in their community, and they have a great Twitter page, web page, newsletter, and more. So you can follow Dr. Lenstra and get a lot of more creative ideas. Now, one thing some libraries are doing is offering exercise classes on site. So maybe things like Tai Chi, yoga, or Zumba. You could probably think of others. Healthy food preparation classes, and I know there are some libraries that have gotten funding so they can purchase a demonstration food cart, which is a really great way to get some speakers in or some people to demonstrate how you would eat healthier. Now, this is a very clever idea from Emporia Public Library in Kansas. They celebrated National Soup Month by providing soup starter kits to people that wanted to come in to the library and grab one of those. And many public libraries offered health insurance marketplace assistance to help people sign up for health insurance. And as I briefly mentioned, perhaps it's a great place to let local weight loss programs like Weight Watchers have meetings in the library. And I love this idea from Boston Public Library. They provided a spice bank collective so people could donate their unopened spices and dried herbs to food pantries, and that was a way to help support the community. Some public libraries have also started even employing social workers as helping professionals on staff, which can help them respond to communities' needs. And then finally, in 2020, people over 50 years of age lost a $1.8 billion to fraud. So I think it's a great idea that libraries are providing classes on how to prevent health fraud, not just for older people, but for anyone. So public libraries serve as important community centers and civic hubs. I know that was a lot of information in a short time, so I'm going to open it up for discussion, comments, and questions. And I'm going to move to my last slide, which will give you contact information for me, as well as the website, nchealthliteracy.org, which is intended for health professionals, but there is a tab there, and shortly later this week, there will be this presentation and handout available for you there, as well as other things under the tab for librarians that may be helpful to you. So I think I will stop sharing and see what questions there are.
Thank you so much, Terri. So yes, round of applause.
Thank you.
So if you're in the room and you have questions, you're welcome to come up to the mic so we can all hear you. Folks attending virtually, I can see the Q&A and the chat. So we have, about 10 minutes for questions.
That was good timing. I'm always worried about either too short or too long. So that wasn't bad, especially for a Monday.
Yes.
And, sometimes questions won't occur to you till you are in the thick of it, or maybe you decide you want to develop some type of program. So I'm available for, even if you want to chat or, just think about ideas and run them past me. As I said, I did work for NNLM, so if you decide to go for some funding, I can help you think that project out as well and give you some helpful hints to hopefully get funded.
Mhm. Well, one thing I didn't know before we spoke, Terri, was that the folks like at UNC Chapel Hill Health Sciences Library, that you really are available for all librarians and patrons as a resource. So not just for the folks that attend UNC Chapel Hill or those in academic libraries, but that anyone can really reach out to you with your consumer health questions.
Yes,
That's
thank
something
you,
I didn't
Amelia.
realize, but yeah.
Part of the mission of UNC Chapel Hill is to provide, to serve the citizens of North Carolina. So we are a public university, and we are open to serving everyone. I see there is a question from Jenny about health professionals or students to learn how to communicate with consumers. I love that question. I regularly do training for health professionals and students on using plain language and using a method called Teach Back to ensure that communication has indeed taken place and that the person, the patient, and their families know what they need to do. I would start at nchealthliteracy.org, where I have a lot of different resources posted, but there are, let me just say, Jenny, there's a ton. There are tons, and there's some great YouTube videos to demonstrate effective and clear health communication between doctors and nurses and other health professionals and patients and their families. Thank you for that question. Oh, yes, and a community college have a lot of different health sciences programs. So if you aren't already providing some type of health literacy class or how to evaluate health information on the internet, there are a lot of resources out there to help you serve the students better. Thank you, Jenny.
Any other?
And as, oh, go ahead.
Yeah.
Go ahead, Emily. Amelia, I'm sorry. Go ahead.
Just opening it up again, if anyone has questions in the room.
And it is Monday, so I understand. And like I said, something might occur to you later. But know that I love to have, to help people. And, I should make use of all of my extensive years of experience. So
we do have a question from someone in the room, so go ahead.
Hello. Thank you. I was curious about funding for the demonstration food carts. Do you know any sources to help with the Charlie card expense? And then one other thought I had with the Noxalon kits. In our county, we were advised against that because of illegality for insurance. Something might happen and it wouldn't be covered. You know, if that's still a trend. I mean, how do we get around all that?
Yes, that is a big concern, and you will have to confer with the legal minds with your system. But I think some libraries are employing social workers and others with that kind of knowledge to help with that. But yes, there are some libraries that don't want to provide that type of service in their library. And I'm sorry, what was the first part of the question?
The first part was about funding for the Charlie carts, the food.
Thank you. Yes.
Kit.
Thank you. The ones that I have seen were from the IMLS funding, but I believe NNLM would entertain that as a potential funding project, as long as you included resources from the National Library of Medicine. So that's something you could talk about. And I believe there's also some private foundations that might fund a food demonstration cart. And it's fairly, I say fairly inexpensive, but at least in the smaller amounts of funding that you can get through some of these smaller grants. I think the one that I saw about a year ago was approximately $4,000 for the cart. But again, funding agencies like to see partnerships and collaborations. So the more that you can connect with others that are doing this type of information, they would be, I'm sure, happy to work with you on a project to get that funded. I hope that helped.
Yes, thank you.
Most of the NNLM funding is under, I think, $10,000, some up to $20,000. And they have a fill in the blank form. So if you've ever applied for other government funding, you know that can be, very intense. But the NNLM is a great way to get your feet wet, so to speak, dip your toe in the funding arena and try a smaller project and see how that goes, and then build upon that experience.
Oh, all right. We've got one more question.
Hi. So you were talking a lot about public libraries, and I feel like that is kind of like the front line of this issue. I work at an academic library, and I was thinking, well, probably the students also need some health literacy and some assistance with that. I don't know if you have any examples of other academic libraries, non-health sciences academic libraries, who are making concerted efforts for health literacy focused on the student population.
Yes, and that's a great point. I'm so glad you brought that up, because anyone, right? All of us at some point, or in our families, and like even if we're lucky enough to have perfect health, people always need to know how to navigate and find trustworthy and authoritative health information. So I am a proponent, and I've seen other libraries, academic, community college, public, even special libraries that don't routinely offer health information services. Anyone can do it. And I think a lot of these that don't focus on health have trained like 1 or 2 key staff members to be able to serve as a consumer health information specialist. And that is a benefit that you could have to earning that certification. Not only does it look good on your resume or your CV, but it also shows your library administration and that you are dedicated to that, and that you have the knowledge and skills to be able to help people with that. And I know that there's many librarians that you're the connection for your family, that everybody asks you to help them get information, whether it's about health or any other topic. So I think all of us could be good at helping people find the information they need to make the decisions. At the very least, know and be prepared with a list of questions when you go to the doctor, because we're often rushed, right? We have very little time, and you need to prepare. And sometimes you have to go back for questions because you might be overwhelmed. Did that help? I hope.
Yeah, and I think the certification you mentioned is linked in your slides and the handout. So if you want to learn more, you can see that in the session materials.
And again, I'm thrilled to be a speaker today. Yes, Terri, I love it. The AHRQ has question builders. They even have an app, a question builder app, so you can help prepare. They also have some great videos. And there is, I mean, if you start looking, there are an overwhelming number of resources. So again, if you ever just want to chat or talk about anything, project ideas, need information, need help with a hard consumer health question, I and the team are here for you at UNC. And thank you again, everyone, for attending and for your interest in this. And thank you, Amelia, for all your help preparing.
Thank you so much, Terri.
And I do hope you get a good vacation day or two.
It's coming up. Yeah. All right, let's give Terri a round of applause. Thank you, everyone.
Thank you, everybody.